As childhood vaccine rates are on the decline, the CDC has tallied the highest number of measles cases in a year since the disease was declared eliminated. And we're only halfway through 2025. Last week, the CDC reported 1,288 cases. The previous record was in 2019 when there was a total of 1,274 cases. So here to help us make sense of this is former Baltimore Health Commissioner and emergency physician Dr. Leana Wen. And Dr. Wen, I want to talk about measles and the lack of vaccinations there, but also the big picture, because you wrote an article about the trends when it comes to more and more people being unvaccinated. Tell us about this.
Well, this is a significant issue. We know for measles, for example, that it's one of the most contagious diseases in the world, and that you need about 95% population immunity in order to stop outbreaks. We were at over 95% pre-pandemic, but unfortunately, the numbers have fallen. According to the latest CDC numbers, the percentage of kindergartners who've obtained both doses of the measles, mumps, and rubella MMR vaccine has now dropped to 93% nationwide. And there are 14 states where that number is less than 90%. And of course, there are pockets of the country where the vaccination rate is substantially lower than even that. For example, in parts of Texas, the vaccination rates are 80%, 82%, and that's what's triggering these outbreaks of measles. And it's not only measles, it's often said that measles is the canary in the coal mine, that when you see cases of measles starting, you could also then see other infectious diseases returning. And I think it's just a real tragedy that diseases that we thought were eliminated, that we as parents and clinicians thought we would never have to see again, are now back.
And so tell us more about how this could impact even vaccinated people. I know you talked about that in your article.
Right. And so there are people who say, well, measles is not that big of a deal. And it is true that the majority of people who contract measles will have viral symptoms and they'll recover fully. However, we have to keep in mind that the rate of complications is significant, that vaccination, first of all, is very effective, 97% protective against measles infection, and also reduces the chance of severe illness if you are vaccinated, but you could still have a chance of breakthrough infection. And individuals who contract measles, 1 in 5 end up hospitalized, 1 in 20 end up with pneumonia, 1 in 1,000 could get severe brain swelling, leading to permanent damage to their brain and nervous system. 1 to 3 in 1,000 children could die. And this is a very serious disease. And the other thing to mention is in recent years, we have gotten to know that there's a phenomenon called immune amnesia, where essentially we know now that measles can reset the immune system so that individuals who thought that they previously had protection against certain diseases through vaccination or prior infection may lose the immunity against those other diseases as a result of contracting measles. And so this poses a real problem for older individuals and people who have chronic medical conditions who have to worry about not just measles, but other diseases if they contract measles.
Yeah, like how could declining vaccine rates potentially bring back other diseases that we've eliminated here in the U.S.?
I think that the vaccine skepticism around MMR vaccine, or if people are saying, well, measles is not a big deal, they're wrong. But also the same kind of vaccine skepticism will then bleed into skepticism around other vaccines too. And this is something that all of us can help to combat. I would highly recommend that people go to the American Academy of Pediatrics website. There are conversation guides that clinicians use with their patients that perhaps can also help individuals speak to their family members or their neighbors or their loved ones, the parents of other children in their schools who may have questions. It's important to respond with compassion and also state the facts. And of course, there's a lot to do on the policy levels too, to make sure that it's not just a matter of skepticism, but also about access, that we have to continue providing coverage for these vaccines so that ability to pay doesn't become the rate limiting factor that allows people to get vaccinated.
All right, Dr. Leana Wen, thank you so much. Important information there. We appreciate it.
She's a great doctor. I love listening to her.
She is.
She knows her stuff.
She absolutely is.
A new report estimates that more than 14 million children worldwide have never received a single dose of any vaccine. The study by the World Health Organization and the UN's Children's Fund points to global conflicts as threatening some of the progress in immunization efforts in low and middle income countries. And in many high income countries, immunization has been affected by vaccine hesitancy and distrust in institutions, leading to a resurgence in diseases like measles.
In fact, there have been more measles cases in the United States this year than any other since the disease was declared eliminated a quarter century ago. Here's Health and Human Services Secretary RFK Jr. on the rise in measles cases.
Most of the cases are unvaccinated Americans. There are some populations that do not want to vaccinate. We're making sure that there are protocols for treating people who actually get measles. So, if in the individual states, if there are issues, we are there for them. But we don't at this point consider it a national emergency.
Joining us now for some perspective is Dr. Paul Offit. He's a member of the FDA's Vaccine Advisory Committee and the Director for Vaccine Education Center at the Children's Hospital of Philadelphia. Doctor, thanks so much for being with us. Do you see this measles outbreak as an emergency?
Well, it's the biggest measles outbreak we've had in this country in 33 years. We've had two healthy young children, 8 and 6-year-old little girls in West Texas who died from measles. That's the first death of a child in this country since 2003. And that child in 2003 was immune compromised. Yes, I consider it an emergency. And I think what Robert F. Kennedy Jr. should do as head of Health and Human Services is use his platform, stand up and loudly and clearly say, we need to vaccinate our children. I think that the statement that you just played was pretty weak. I think he needs to get up there and take his position and make it clear that these are preventable deaths, and it's unconscionable that children in this country are dying of measles when it is a preventable disease.
How would you describe, Doctor, what he and what HHS have been doing when it comes to vaccines?
Well, this outbreak is a perfect example. I mean, if you look on the CDC's website, it says that there's been roughly 1,300 cases of measles. That is a vast underestimate of the actual number. If you talk to people on the ground, they think it's at least 3,000 cases. And worse, for example, there was immunization clinics in Dallas. There were about 21 immunization clinics that were set to go, but yet they had their funding cut back, so they couldn't vaccinate children in high-risk areas. We're not doing what we need to do in this country, in large part because of cutbacks in surveillance for measles from the CDC and also in local health departments. It's hard to watch.
This report also looks overseas, and I'm wondering, with the dismantling of USAID, where are some of these low and middle income countries around the world that struggle with immunization efforts going to get help in doing that?
Right, not just USAID. I mean, Robert F. Kennedy Jr. stood up recently and said that he is not going to fulfill the obligation that was put forward by the Biden administration of giving $1.2 billion to Gavi, the Global Alliance Vaccine Initiative. He holds up this bogus paper that says that the AP vaccine was unsafe, which was completely wrong, and says we're not going to be giving the $1.2 billion to Gavi that we said we were going to do because the world is not paying attention to safety issues. So this is what happens when you have an anti-vaccine activist and science denialist in a position of power. And so it's been hard to watch. I mean, we're a wealthy country. We're a technologically advanced country. I think we have an obligation to helping those who are less fortunate, and we're doing exactly the opposite.
Dr. Offit, what is your message then to parents who are concerned about vaccinating their kids?
I think it's reasonable to be concerned about anything we put into our children's bodies, but you should be reassured that there is abundant evidence that vaccines are safe and effective. And we can't allow this erosion in vaccine rates to cause children to suffer and be hospitalized and die. There's so much in medicine we don't know. There's so much we can't do. This we know, this we can do, and it's very hard to watch the way this is playing out.
Dr. Offit, thank you so much for being with us. We really appreciate it.
Thank you.